Alright friends, let's get real about congenital CMV infection. A topic that seems simple, but can really trip you up in exams like the INI CET. So, I'll break it down in a way that'll stick with you, not just for your test, but for your clinical practice too. Let's kick things off with the INI CET 2021 question. Which of the following is a true statement about congenital CMV infection? The options? You'll probably recognize these if you flipped through recent question banks. 1. About 20 to 30% of infections are symptomatic. 2. The classic triad is SNHL, periventricular calcification, and enamel hypoplasia. 3. Most children who are asymptomatic at birth can develop conductive hearing loss later in life. And 4. If the mother is IgG positive for CMV, the child is unlikely to develop an infection. If you've been revising, you'll know the answer is option 4. But let's figure out. First, congenital CMV, or cytomegalovirus, is the most common intrauterine infection. Yet, here's the thing. Most infected babies are totally asymptomatic at birth. Only about 10 to 15% actually show symptoms, not 20 to 30% as the question suggests. So, option 1, that's out. Next, the so-called classic triad. Now, you've definitely heard about sensorineural hearing loss and periventricular calcification, but enamel hypoplasia doesn't belong here. The triad you should remember is actually chorioretinitis, intracranial calcifications, and sensorineural hearing loss. So option 2 is also a no. What about option 3? This one's tricky. Most children who are asymptomatic at birth develop hearing loss, but it's sensorineural, not conductive. That's the key distinction. Conductive hearing loss is usually due to problems in the external or middle ear, while CMV damages the cochlea, causing sensorineural loss. So, option 3 is not quite right either. Which brings us to option 4. If the mother is IgG positive for CMV, the child is unlikely to develop infection. And that's true. Why? IgG positivity means she's had a past infection. She's got those protective antibodies ready. Primary infection during pregnancy is risky, but if she's already immune, the chances of transmitting CMV to the baby drop dramatically. That's the point you need to remember for your exams and for your real-life patients. Let's wrap this up. In summary, congenital CMV is common, but most babies are asymptomatic. Classic triad? Not what you think. And maternal immunity is a huge protective factor. If you found this helpful, make sure to like, subscribe, and drop your doubts in the comments. I'll be back with more high-yield exam topics soon. All the best with your revision.